The Vinflunine, that is an agent that I was the lead author of the approval of Vinflunine in Europe, and it's available in Europe, has been used in second line, third line. And we designed a trial that was named the MAJA trial that we published in Lancet Oncology, where with a similar design, patients receiving chemotherapy in first line were assigned to receive Vinflunine versus best supportive care. We saw a benefit in progression-free survival. The trial was a small randomized phase II trial, not powered for overall survival, but subsequent analysis didn't show a survival difference. The same happened for pembrolizumab maintenance. In the pembrolizumab, the Hoosier Oncology group designed this trial. Patients after receiving first-line chemotherapy were assigned to receive pembrolizumab or best supportive care. In this trial, pembrolizumab was allowed to cross over in patients that were progressing, and only a progression-free survival benefit was observed. So presently, the only trial that has level 1 evidence of a survival benefit is the one using maintenance Avelumab, the JAVELIN 100 trial.